The partnership that we've got with Melbourne University has been, for us, one of the most beautiful partnerships. I think anywhere where we can have a benefit that gives back to the community and gives back to workforce, I think that's incredibly important.
Going Rural Health sits within Melbourne University in the Department of Rural Health. We support nursing and allied health students who are undertaking their clinical placements within our regions.
We're a multi-campus health service which provides what I like to say from birth to death and everything in between, and we provide a full range of allied health services across our 3 campuses.
Going Rural Health has provided support to Maryborough through a number of ways, through providing external supervision, through providing some support to students and also to staff in terms of education and training to build that capacity to take students. Many of our placements are service learning placements. This is where students get a really great hands-on learning experience, they develop their discipline-specific skills, but at the same time they're providing much needed services to the local communities.
It's really lovely to kind of see the differences between a metro versus a rural placement. You get to really understand what each has to offer.
The research tells us that students who can have a rural placement experience and cultural immersion, that does positively impact their intention to practice rurally.
So some of the challenges we see in this area are around staffing, really, particularly at the moment. But we find those clinical placements really important to be getting students out in the rural areas.
Well, when I first started supervising students, I was here as one of 2 part-time workers. And so to take on students, we actually had to increase our own work hours. So we did that for a little while and found it very challenging and very hard to give them a great student experience. And then Going Rural Health came along. So they came in and offered to support us with our student placements by providing a physio to come out and do external supervision as well. And that was just fabulous.
I feel like I've got quite a bit of different exposure to patients here. I've been working with patients that are unique and different in how they present, and so that's been really cool to experience all of that in the one setting compared to multiple different settings. For me, it's been a really good experience because you also get to learn more about yourself as well.
One of the really valuable things is that the students get to see firsthand the impact that their work has on the lives of the people that they're working with and on the community as a whole.
I guess all the projects that they've helped us to implement really come back to that changing the healthcare story for our community.
So when I first started in this role, Marg was in a chair a lot of the time and not walking much at all. So through my role as physio and looking after her, we got her up walking more regularly, but it wasn't until we had the student placement that she was able to get so much more physio and one-on-one physio on nearly a daily basis. Her comment yesterday was that the students aren't here for long enough. She'd love to have them here for longer, so I think it's just a great way that we could utilise the students and give them that experience, but also the benefit for the residents is just fantastic as well.
So Going Rural Health has seen some really amazing growth in the student program at Maryborough in recent years, to a point where the health service is pretty much fairly self-sufficient and sustainable in running their student program. So we've seen student placements expand across disciplines of allied health and more students being able to come through the health service.
It's an exciting time for us at MDHS. We've just opened our student accommodation, which we're sitting in today, which is fantastic, and that means we've got 20 beds here, which enable student placements, which we're really invested in providing a great, well-rounded student placement for our future workforce.
The facilities here are so lovely. It's such a warm and comfortable environment, and I'm very lucky to be staying here in a place like this.
Over the years, we've had students from lots of different universities come, and I think they get quite a surprise when they come up here, see the different sort of lifestyle that we have. They often walk away from the experience thinking, wow, that was such a different experience for me, and maybe it's something I might consider in the future. Because that's our aim, is to increase our workforce and get more people up into the country areas, because it's such a good place, not only to work, but to live in the lifestyle that we have.
Everyone is so welcoming and friendly, and it's just really nice to see that big community feeling and feel really welcome.
It really does give you that really broad perspective on what it means to work within health in the rural setting, and it is different to that within the metro environment, and I think it's one of the most rewarding places to live and work.
It's great to be a part of, I guess, future-proofing the workforce and contributing towards student growth, but also hoping that some of the students might come back to work rurally.
Yeah, I definitely recommend. Give it a go. You know, you'll be surprised. You might find out something that you wouldn't have learned if you didn't come.